Welcome back to Medicine Deconstructed. I'm your host, Dr. Jay Rutland. Let's talk Mark Cuban. Sure, he owns the Mavericks, or rather just sold a majority stake in them to another family, but I've always been a fan of his since he bought the Mavs and started on Shark Tank. Recently, his company, Cost Plus Drug Company, has made noise in the industry. Let's talk about what he's doing and how it's helping our patients. Let's talk about prescription drugs. Normally, physicians like me are going to prescribe drugs, and then insured patients are going to end up with the drug in their hand, whether they make a copayment or if they don't have one. A copayment is an amount of money a patient is responsible to pay for a particular product. To really understand all the process it takes, we have to understand pharmacy benefit managers, or PBMs. PBMs are companies that manage prescription drug benefits on behalf of health insurers: Blue Cross, Blue Shield, Aetna, Cigna, etc. Medicare Part D drug plans, large employers, and other health payers. These companies negotiate with drug manufacturers and pharmacies to control drug spending. They have a true behind-the-scenes impact on costs. They face a lot of scrutiny, and I'm going to get into that, and you're going to see why. They maintain lists of drugs on formularies. They use purchasing power to negotiate rebates, money back to them, and discounts from drug manufacturers, and contract directly with individual pharmacies to reimburse for drugs dispensed to beneficiaries. Medicare has stated that PBMs negotiating larger rebates has reduced the cost of medicines overall. However, PBMs may receive rebates that are larger for more expensive drugs. Also, rebates are money, and the money can be redistributed to help lower costs or can simply be kept by the PBM. If this happens, pharmaceutical companies are going to increase the price of their drugs to offset how much money is going to go towards their rebates or back to those PBMs. It's a crazy process that we don't talk enough about. More transparency is necessary when it comes to this process. So what's Mark Cuban doing? It's really no different than other companies. But Mark Cuban's Cost Plus Drug Company is a transparent, cash-based pricing model for hundreds of prescription products, mostly generics or all generics. The company wants to reduce the cost of medications, and they let you know 4 things: the cost of the product to them, the 15% markup that they're charging you, $3 labor fee, and a $5 shipping fee. They're not a pharmacy, and they partner with TruePill, which is a digital pharmacy. They also partner with wholesalers and just buy the products. There's something called the average wholesaler price, or the AWP. In the United States, the average wholesaler price is a pharmaceutical term that describes the average price paid by a retailer to buy a drug from a wholesaler. But there's only 3 major wholesalers in the United States. You got McKesson, Amerisource, and Cardinal. There are hundreds of secondary wholesalers who only buy generic products. So those primary 3 wholesalers can buy any product. What these guys are going to do is they're going to buy product directly from the manufacturer, big pharma, or a generic manufacturer, right? A company that generates and makes just generic pharmaceutical agents. But what the AWP is basically the price of what pharmacies charge patients when a medication is not covered in their insurance. For example, losartan, which is a common antihypertensive that lowers your blood pressure. 30 pills costs $5, but the AWP is $120. If insurance doesn't cover losartan and the patient wants to pay out of pocket, they would pay the pharmacy $120, even though it only costs the pharmacy $5. It's kind of crazy. Cuban's company and others who have been doing it for years charge a transparent markup plus a labor fee, which makes the cost significantly less for patients. In other words, they don't really care about the AWP.
Don't buy it. I'm out.
Okay. In my office, we partner with pharmacies that do this for us. I love companies who try to make the process cheaper. Transparency is necessary. And instead of having the PBM, a pharmacy, a wholesaler, all of whom consider an AWP, which leads to increased cost, cutting out middlemen, at least for generic medications, is important. It's going to allow for our patients to be able to afford medications that are necessary for their survival and for their well-being overall. I think this is an important lesson for all of us to learn. I really appreciate you guys joining me today on Medicine Deconstructed. I hope you understand the cost of drugs a little bit better. We'll see you next time.